from Matt Harvey and Sandy Alderson on the decision to hold off on surgery. Let's head inside to the press conference room here at Citi Field.
Throwing program of 6 to 8 weeks potentially, and we'll see what the outcome of that is, depending on how he responds to that throwing program, how his elbow responds to that program.
Okay. What would you like to question?
For Matt or Sandy, after seeing Dr. Andrews, can you say what the severity of the tear is, kind of what percentage or anything like that?
Well, Matt can add to this. To my knowledge, the doctors have never attached a percentage to the tear. It's a partial tear. It's not a full tear. No one has said it's 50%, 80%, 20%. The MRI confirmed a tear, but these examinations consist of not only an MRI but also a clinical exam of the elbow itself for stability, strength, and so forth. And that's the basis on which both Mets doctors and Dr. Andrews made their diagnosis.
Matt, can you just tell us a little bit about what it was that you heard that and why you made this decision, or how you came to this decision?
You know, obviously, going through the MRI and you know, having that picture, you know, we knew that there was a tear there, and you know, going to see Dr. Andrews, and he went through all of his tests and you know, strength, like Sandy said, and you know, he believed that it was you know, very stable, and you know, I've never had pain in my actual elbow area where the UCL is, and you know, I just, for me, it felt like you know, why jump into surgery in a situation where I never had you know, the tingling, the numbness, the shooting pain in my elbow that you know, are usually the symptoms of needing that surgery. And you know, for me, if you know, a rehab process and strengthening you know, process is the way to go, that's in my mind, that's what I wanted to do.
Adam in the back.
Matt, was either from the Met doctors or from doesn't sound like from Dr. Andrews, any ambiguity about whether you need the surgery or not? Were they like, maybe you should, maybe you shouldn't, so just let it go for a little while and see how it goes, or how did it work?
Well, I think, you know, both doctors obviously viewed the MRI and noticed that there was a tear, and you know, in history shows that, you know, if you have a UCL tear, you need to replace it. You know, I think both doctors came to the conclusion of, you know, going through a rehab process, pick throwing back up, and see how it goes from there. And you know, if reoccurring symptoms come from that, then obviously the road that needs to be taken is surgery. But you know, in my mind, if I can you know, rehab and make sure everything is strong, obviously from Dr. Andrews' tests of, you know, elbow stability, it you know, nothing was moving in places it shouldn't. So,
may I ask one thing to Sandy too, if you don't mind? Does this complicate at all your winter? Because I mean, or do you just go full throttle thinking Matt's going to be fine, or do you have to hedge that a little bit?
Well, I think there's some ambiguity, of course, at this point, and maybe through the next couple of months. There may be ambiguity beyond that. I don't think it's going to affect our off-season planning as much as has been speculated. The one thing we have is a great deal of starting pitching depth, some of it untested at the minor league level, but we have a lot of confidence in the quality and quantity of our starting pitching. So hopefully Matt is part of that rotation next year, but if he's not, I don't foresee us working hard to fill his spot from outside the organization.